So today's chapter is diet in liver diseases and pancreatic diseases. It's chapter 18, page number 390. Those who have the textbook, page number 390. If you have the recent version of the textbook, page number may slightly vary. So please mention the page number in the chat box if you have the recent edition. So diet in liver diseases. First of all, what is liver and what are its major functions? Okay. So liver is internally, skin is your largest organ, but apart from that, liver holds the weight. Okay, it has it is quite heavy, and around 36,000 functions are carried out by a healthy liver. Okay, and metabolically, it is one of the most metabolically active organ in your body. Okay, it contributes a lot towards your metabolism. Okay, detoxification, there are other functions as well. So detoxification, liver as well as the kidney, and also your skin. Okay, when you sweat, when you perspire, when you sweat, your skin also acts as a detoxifying organ. Okay, internally, liver and kidney are the two main organs for detoxification. Okay, drugs, alcohol, any medication that you have took. Okay, alcohol, fatty acids, steroid hormones, ammonia. Okay, that is converted into urea and it is out of the system. Any environmental toxins, allergens that have entered your system. Okay, to get them out of the system, liver will detoxify the blood that comes into the liver. Okay, the blood that carries these drugs, alcohol, fatty acids, toxins. Okay, the blood will get purified in the liver. Okay, production of cholesterol, which is cholesterol is required for to produce a lot of hormones in your body, to produce vitamin, to synthesize vitamin D within your body. Cholesterol is required, so the production of cholesterol also happens in liver. Okay, storage of a lot of micronutrients, all fat soluble vitamins and micronutrients like iron, magnesium, copper, zinc. Okay, fat soluble vitamins like vitamin A, D, E, K. Okay, B12. Not all the B complexes. Other B complexes are water soluble. B12 can still be stored in the in your body and it can be synthesized as well. Okay. Sure, balancing your blood sugar level by storing glycogen. If the blood sugar level goes up, liver will take up the excess glucose, convert it into glycogen and store it. Okay, and because of this, your blood sugar level comes back down to normal. Okay, production of bile juice, bile salts are required for digestion, especially lipid fat digestion. Okay, and it bile salts are antimicrobial in their nature as well, so it helps to kill all the bad bacteria that enters your gut. Protein synthesis like blood clotting factor, prothrombin is a blood clotting factor, producing prothrombin, producing proteins for transporting the fatty acids from point A to point B. Globulins that help in boosting up your immunity, albumin that creates a, blood pressure within the serum. Okay, ceruloplasmin. Ceruloplasmin helps in the transport of copper within your body. Makes sure that copper, even if it is you have enough copper in the food, but if you don't have ceruloplasmin, okay, copper will not be absorbed and transported within your body. So these protein synthesis, specifically these all protein synthesis is done by the liver. Okay, the proteins that carry cholesterol or fat, the proteins that carry copper, okay, blood clotting factors, immunity factors, immunoglobulins, okay, albumin, Okay, these proteins are synthesized, are produced, manufactured in liver. Okay, immune system, it contains viruses and pathogens. Okay, while detoxifying the blood, it takes care of the infectious viruses and other toxins and bacteria within the blood as well. And the immune cells that are available in the liver, that will take care of disintegrating the pathogen. To maintain the hepatic and portal vein immune system. Hepatic vein and portal vein is one of a very large vein that passes through the, it vertically passes through the liver. Okay, and it carries and through the portal vein, whatever blood gets into the liver and passes through the liver, it gets detoxified. Okay, so it maintains the immune system around the portal vein to purify the blood out of toxins. Metabolism, converting T4 to T3. Okay, the thyroid hormones. Detoxification of fats as well, that is the metabolic function. So these are the main functions of liver. Okay, critical functions of liver. There are a lot of enzyme production as well. Enzyme production also takes place in liver that they have not mentioned here. Just like protein synthesis, enzyme synthesis also takes place in liver. So these are the major functions of a healthy liver. If you have a healthy liver, if you do not have alcohol issue, if you are not taking some alcohols or substance abuses are not done on a daily basis, okay, your liver should function well until and unless you have some autoimmune disease, or you have some hereditary disorders pertaining to the liver, or you got infected by hepatitis. Okay, until these conditions exist, your liver, a healthy liver, should be able to do all these functions. Is it clear to all? So coming to the liver damage, stages of liver damage, a lot of dietary imbalances could lead to liver damage. It will not happen within a week or so. Okay, liver damage takes place over the course of certain months. It may take years also to reach the last stage of liver damage. Okay, healthy liver, slowly it will convert into fatty liver. Fatty liver means large doses of fat get accumulated in the liver. Okay, it is not getting detoxified by the liver. So it stays, it is stuck up in the liver. Healthy liver will be able to move out. Okay, it is able to push out excess amount of fat. That is detoxification of fat. Only what is necessary to store the fat soluble vitamins, that amount of fat will be stored. The remaining fat that is not required will be pushed out. Okay, but when your diet is quite high in fat, okay, the liver will not be able to do this function well, and big globules of fat and lipids will start to accumulate in the liver cells, hepatocytes. Okay, and slowly uh, the cells, the liver cells that have big number of fat deposition, they will undergo scarring. Okay, they will undergo scarring because the liver's immune system will try to attack these cells to get rid of the excess fat. Okay, and then the cells will undergo scarring. It will get damaged. The healthy cells and tissues will get damaged, so that leads to fibrosis. Fibrosis means scarring. Okay, and then when fibrosis of liver also keeps growing, more and more healthy tissue of the liver has become scarred tissue. Okay, then that stage is liver cirrhosis. Okay, and sometimes a patient who is critical with liver cirrhosis can pass away They can die. This is liver cirrhosis is also a fatal condition. Okay, patients may pass away at this fourth stage, or sometimes cirrhosis can further develop into cancer. Okay, so these are the stages of liver damage. Children who suffer from kwashiorkor, okay, that's a protein allergy malnutrition. Kwashiorkor is a type of malnutrition. The children who suffer from kwashiorkor also suffer from liver damage, fatty liver especially. Agents responsible for liver damage. First is your dietary imbalance. If you are having high trans fat, okay, too much of trans fat is available in your diet. Fatty liver can be reversible. Okay, with lifestyle changes, with dietary modification, you can reverse fatty liver. Fatty liver is also of two different types: alcoholic fatty liver and non-alcoholic fatty liver. So, with proper dietary changes, you can still reverse fatty liver. But even if you have reversed your condition, you will always have a predisposing risk of developing fatty liver in the future. Okay, if you go back to your previous lifestyle or diet, immediately it can revert back. Too much of fatty acids in your diet and not able to lipolyze, not able to produce enough bile salts to break down the fat, that could lead to fatty liver. Not able to transport fats properly because you do not have the protein, lipoprotein, that is supposed to transfer the fat out of the liver into the body system. When you don't have that, fats get stuck back in the liver. So when you're not consuming protein rich diet, that could also lead to that can also aggravate the existing liver damage. So a diet that is too high in calories. Okay, so while to deal with that, the liver has to work overtime to process all the extra glycogen and fat. Okay, that could lead to damage or severity of the condition. And fatty liver could also lead to gallstones, cholelithiasis. Too much of triglyceride in the food, that will also affect the liver health. And too much of triglyceride you will get from red meat, non-vegetarian food, processed food, baked food, okay, deep fried food, um, stir fried food, fishes that are stir fried as compared to the fishes that are made in a curry form. Okay, stir fried fishes have more calories as compared to the curry form. So these are how triglyceride levels in your blood will rise over the period of time. And slowly, while getting rid of high amount of fat, these fat will go through the liver for detoxification. Liver is incapable of detoxifying such a huge amount of fat, and these fat will get trapped back in liver. So that leads to liver damage. Then some infective agents, specifically all the hepatitis agents, hepatitis A, B, C, D, E, G. Okay, these are the viruses. Hepatitis is a viral infection, and it can spread, okay, between through contact. Uh, when you touch the patient who is suffering from hepatitis through contact, direct or indirect contact, it can spread. Hepatitis A and E virus are excreted in the stools and they spread through fecal-oral route. So if we are using the bathroom that has been used by a hepatitis A or hepatitis E patient, that could lead to you also getting hepatitis. So patients who are suffering from hepatitis will have jaundice-like symptoms, that is their skin color, the sclera of the eyes, nail color, urine color will be extremely bright yellow in color. Recovery from hepatitis is possible, but still, um, some area of your liver will have undergone some level of fibrosis and scarring. And even through, if you go to a hospital, you can get hepatitis if the hospital is not practicing sterilization techniques, disinfection techniques properly. You are going to get an infection. And now a hepatitis vaccine, the vaccination you get against hepatitis is also compulsory in healthcare departments, hospitals, where the staffs who work in the hospital, they all have to get the hepatitis injection, immunoglobulin injection. So these are the infective agents: hepatitis A, B, D, E. Then certain toxic agents like alcohol, too much consumption of alcohol on top of malnourishment, okay, that could lead to hepatic failure. And alcohol is also proven to have a direct link towards hepatitis and liver cirrhosis. And apart from that, conversion of CoA, acetylcholine 8 fatty lipids are also done by drugs and chemicals as well. If you're abusing any drugs or chemicals, that could also lead to uh, liver damage over a period of time. Drugs like paracetamol, uh, isoniazid, estrogen, that can, over a period of time, for a long term, if you're taking it on a daily basis, it can damage the liver. Workers who work in certain industries that develop hydrocarbon can also develop liver damage. And also certain herbal preparations under Ayurveda or allopathy or homeopathy. Certain Ayurvedic medications also have shown to cause some liver damage. Then inborn errors of metabolism, children who are born with a certain type of disease condition like tyrosinemia, galactosemia, inherited fructose intolerance. So as I mentioned earlier, liver is also supposed to produce specific enzymes. Okay. So when the liver fails to produce specific enzymes since birth, it becomes an inborn metabolic disorder. So is it clear the agents that cause liver damage? So far, is it clear to all? Then damage caused to the liver. What extent, what level, what degree of damages are caused to the liver? Non-alcoholic fatty liver will not return to normal liver, but you can prevent further scarring. Okay. In non-alcoholic fatty liver, some level of scarring has taken place. You cannot reverse that, but you can do dietary changes and make sure that um, further scarring will not take place. Okay, in alcoholic fatty liver as well. Usually the management in alcoholic fatty liver and all, if it has not gone beyond uh, saving, okay, you can still save the patient, you can give them a healthy lifestyle. The motto is usually, so far this much area of the liver is scarred or damaged, that's fine, we have to prevent more scarring as much as possible. Okay. So first is fatty globulation or fatty liver, we call it at fatty liver as well. So fat gets deposited on liver, on healthy cells of liver. The cells of the liver are called hepatocytes. Okay. Non-alcoholic fatty liver, it's majorly hereditary. Also, your diet. If you do not consume alcohol, but you had a really bad diet, okay, high in sugar, high in fat, high carbohydrate diet, no physical activity, okay, you were taking certain steroid medication for a long time because you were suffering from some chronic inflammatory diseases and you were on steroid medication for a long time, okay, that could also harm because steroid medications had to be detoxified by the liver, right? So these medications can also cause non-alcoholic fatty liver, okay, because they are damaging the healthy cells, the way how healthy cells should respond to fat, that could get triggered, okay, and more fat deposits will increase. So fat is present in healthy cells, but it is not visible, okay, because water soluble triglycerides are present. They are linked to the phospholipids. Phospholipids are the cell membrane, the outer wall of the cell. It has phospholipids. And inside you have insoluble triglycerides. What happens is that the number of triglycerides you have inside the cell, okay, the droplets of triglycerides you have inside the cell, if they start to increase slowly day by day because of your lifestyle, your diet, lack of exercise, okay, droplets of triglycerides that are formed inside the healthy cells of the liver, that will increase in its size, increase in its number. That's why you get fatty liver. That's how fat deposition in the liver increases. So fatty liver is also the third cause of chronic liver disease and liver cancer. Fatty liver can lead to liver cancer if it is left untreated. Obesity, diabetes, hypertension are also causes of fatty liver. Means people who suffer from this lifestyle disease, they're also at a higher risk of developing fatty liver. So treatment for fatty liver, you have to avoid certain types of food, drinks, avoid sugary carbonated drinks, avoid eating fried or high fat food. Okay, you may have to depend on nutritional supplements, eat healthy, exercise regularly, try to lose weight. Okay, then you have necrosis. Necrosis means damage to cells. Okay, irreversible damage. So due to too much of alcohol intake, the liver will undergo scarring. Okay, it will become tender. Tender means when you palpate, when the doctor will try to press the area where the liver is situated from outside the body, okay, just to see that do you have a swollen liver or not. Okay, when the doctor will try to palpate your organ, it will feel swollen, enlarged from within, and you will have pain, you will have tenderness. And this is because of the death of, what is necrosis? Death of cells. Okay, when you say necrosis of the liver means death of healthy hepatocytes. Then you have cirrhosis of liver, as I mentioned earlier. In cirrhosis of liver, scarring happens. Okay, there are nodules of hepatocytes that form between the scar tissue. Fibrous tissue means scar. Okay, you look at your body wherever you have scar. Okay, just find out any part of your body where you have a scar. You look at that skin. Okay, and you look at the skin around, the healthy skin around. Okay, do you find some visible difference in the texture of the scar tissue that you have on your body and the rest of the area in in your body that is normal skin? Do you find some change? Yeah, it is the color is different, the texture is different. You do not have any the tactile function will be lost because the nerve endings have been damaged. Okay, you will not sweat from your scar. Your scar tissue will not produce sebum, will not sweat because you have lost the sweat glands and the sebum, sebaceous glands under the skin where a scar has been formed. Okay, so all the functions have been lost. What is left is just some fibers, collagen fibers, elastin fibers. They come together just to patch up the area so that it is not an open wound and it does not keep losing blood. Okay, just to prevent that, we have a amalgamation of collagen fibers and elastin fibers. They find a fibrous tissue. Okay, a fiber network. They don't have healthy cells. Okay, these are just a fibrous network that has patched up your wound in such a way that you don't have an open space there from where infection can take place or blood can ooze out. Okay, so that is a fibrous tissue. So in cirrhosis of liver, the same fibrous tissue happens within your liver. Okay, you can imagine the scar that you have on your skin, which you can see. The same kind of scar has formed everywhere in your liver, with only small pockets of healthy hepatocyte or healthy tissues. Apart from that, majority of the area has this fibrous tissue. And liver is an organ that can regenerate. Okay, if you are doing liver transplant, you don't require a whole organ of liver. If you just give a part of a liver, okay, from that tissue, from that part of the liver, that lobe of the liver, the healthy hepatocytes can regenerate. Okay, and do a healthy function of the liver and continue the healthy function of the liver. So what happens is that even if you see the image here, these are the fibrous, these brown color cells, these are the fibrous cells, okay, fiber tissues. Okay, around them there are healthy hepatocytes, and hepatocytes have a tremendous regenerative quality. Okay, hepatocytes will regenerate in a healthy way. They will divide and they regenerate, divide and they regenerate. One cell will divide into two, two will divide into four, four into divide into eight. Okay, like that the hepatocytes will proliferate and regenerate. Okay, but what happens is that they're surrounded by scarred fibrous tissue. Okay, so when the hepatocytes are regenerating, they are not able to regenerate smoothly. Okay, wherever they are getting space, from there they are regenerating, and it looks like nodes. Okay, it looks like many small nodes, small eruptions of hepatocytes are happening here and there in the liver. Okay, so that happens in cirrhosis of liver. And sometimes the fibrous tissue is so hard that they will constrain the hepatocytes from regenerating in a proper manner. Okay, so that can obstruct the hepatocytes to branch out and function in a healthy way. So that is cirrhosis of liver. Then you have jaundice, too much of bile production, excess of bile production. Bile is a yellowish green color salt. Okay, bile salt. Bile juice is also yellowish green in color. Okay, so when your liver cells are damaged, they become hyperactive and they produce a lot of bile juice. Okay, and that leads to jaundice because excess amount of bile juice, your intestine doesn't know what to do. It will absorb it and it will send it back into your system. So too much of bile salts in your blood, okay, that yellowish green hue will be seen on your skin as well. Your skin will also have a yellow tint. Okay, your sclera, your eyes, the white part of your eyes will have the yellow tint. Your nails will have an yellow tint. When you pass the urine, it is bright yellow in color. Okay, so this is because of excessive bile production that is happening in the damaged liver cells. So is it clear to all regarding the types of damage that happens to your liver? Yes, hepatocytes will regenerate. So infective hepatitis caused by viruses. Okay. Uh, Infective hepatitis is caused by viruses. Non-infected hepatitis is because of alcoholism, okay, drug abuse, too much of toxins in your system. That could also lead to hepatitis. What is hepatitis? Hepa relates to liver. Itis is inflammation. So inflammation of the liver or injury to the liver. Okay, why injury? Because of internal injury, your liver is getting scarred. Okay, scar tissue is forming there. So hepatitis means either inflammation and injury of the liver, and it could be caused by virus, alcohol, toxins, and drugs. Infective hepatitis means it is viral hepatitis. And here the liver could be inflamed or injured because virus has started attacking it. Virus has started attacking the healthy hepatocytes. Okay. So that is called viral hepatitis. And three main viruses that cause hepatitis are A, B, and C. The other type of hepatitis are D, E, and G. And even in infective hepatitis, you will have certain signs and symptoms like anorexia, fever, headache, rapid weight loss. You lose your muscle tone, lack of protein, nausea, vomiting, stomach discomfort. Color of your urine also changes from yellow to dark yellow to red. That is the your blood will ooze out through the urine. Your feces will become whitish in color. And if you are not getting treatment for your viral hepatitis, it can turn into cirrhosis of liver and it could be fatal. So dietary management for an adult, we try to maintain 1800 kilocalories on a daily basis. Okay, your focus should be on protein and carbohydrates, but make sure your fat intake is less, not more than 20 gram of fat. Okay, very controlled way of giving diet, which is low fat. Okay, that is the high protein, high carbohydrate fat diet is given, but low fat or moderate fat is recommended. And small meals at regular intervals should be given. Overfeeding should be avoided because you should not exhaust the liver. So energy, if the patient is on NG tube feeding, nasogastric tube feeding, that happens in hospitals or clinics, okay? So 1,000 kilocalories can be given through NG tube feeding. And in severe cases, 1,600 to 2,000 kilocalories can also be suggested through NG tube feeding. Protein intake should be between 60 to 80 gram. It is permitted, especially with jaundice, severe to mild jaundice. With severe jaundice, only 40 gram, because your liver will not be able to uh, function with protein well. Okay, so only 40 gram of protein, less amount of protein if it is a severe case of jaundice. If it is a mild case of jaundice, just 60 to 80 gram of protein is permitted. And if the patient is in a comatose stage, okay, patient goes into a comatose stage, this is for doctors. If the patient goes into coma, protein is restricted, only high carb diet is prescribed. Fats, just 20 gram of fat is ideal in severe cases of jaundice. Moderate jaundice, they can still tolerate 20 to 30 gram of fat. But fat has to be restricted. If you see there is any obstruction in bile flow, do not because if you do not have enough bile, you will not be able to digest fat well. So if you find the bile, there is any obstruction in the bile duct, or there is too less amount of bile juice that has been produced, okay, in that case you have to restrict your fat intake. Then carbohydrates, high carbohydrate diet is recommended here, so that the body does not go into a state of catabolism. Okay, because when the body does not have enough energy, it will break down its own glycogen stores, protein stores, fat stores to feed itself. Okay, to prevent the body from going into a state of catabolism, high carb diet is given. Vitamins, focus on vitamin C, because that helps in the production of collagen and elastin fiber. It will help in wound healing as well. It's an antioxidant as well. And if the patient is suffering from anorexia, nausea, and vomiting is severe, then you may have to give the patient through IV fluid, or vitamins can be given as an injection as well, like intramuscular injection, or through IV fluid. You have to maintain the vitamin status. Vitamin K is also supplemented along with vitamin B complex. 500 microgram of vitamin C should be given. When it comes to minerals, fruit juices, vegetable broth, meat soup, okay, you can add salt into that. And if the patient can take it orally, they can take. Otherwise, using a nasogastric tube, you should provide them the feed. Maintain the electrolyte balance. In some cases, you may require ORS as well. If the patient is suffering from severe diarrhea and indigestion, you may use ORS as well. Foods that you can include in the dietary management is, see, porridges like oats porridge, rice porridge, ragi porridge, rava porridge. These are the different porridges that you can give. Chapatis without ghee or oil, bread, rice, skimmed milk, tapioca, potatoes, yam, fruit juices high that are high in carbohydrates, jaggery, honey, custard. Without any butter or without any fat, custard can be given, plain custard. Anything that is too spicy, too much of oil is used, or whole toned milk, cream, dairy products you can avoid to prevent the fat consumption. Maintain the water level and the electrolyte level by properly keeping the patient hydrated. So far, is it clear to all regarding the dietary management of hepatitis? Next is the cirrhosis of liver. So cirrhosis, as I mentioned earlier, it's scarring, and through the scar, whatever hepatocytes that are healthy, that remains within the cell, within the liver, okay, whatever healthy hepatocytes they remain, they try to regenerate, but they are not able to regenerate it on a smooth surface, because there is a lot of scarring around. So wherever they get space through the scarring, okay, they regenerate, and that is the reason why you see these nodules, okay, these nodes that you see, okay, eruptions. These are healthy hepatocytes striving, okay, for regeneration. Other parts of the of this liver is scarred. Okay, so this is a uh, diagrammatic representation of cirrhosis of liver. So this is what we call as nodular regeneration. The hepatocytes that are trying to survive through the scarred tissues, these are called nodular regeneration, because they appear like nodes. Okay, and it is a serious, irreversible disease condition. And people who are deficient in vitamin A, they have a risk of developing liver cirrhosis. And it does not happen within a week or a month. It takes years to show up. Okay, liver cirrhosis, it takes years to show up before it is clinically evident with signs and symptoms. And usually the patient, when they arrive to the hospital, it's usually the large stage of cirrhosis with a lot of complication, maybe hepatic coma as well, comatose patients as well. So signs and symptoms in liver cirrhosis, you will see a distended stomach. This is ascites. Ascites means fluid filled peritoneal cavity. Okay, the abdominal cavity, it has a peritoneum. So the peritoneal cavity, it becomes filled with fluid. Okay, so the stomach part will be completely distended. It's fluid filled. That is ascites. Muscle wasting, they will lose a lot of muscle mass, sparse body hair here and there, spider angioma, encephalopathy, that is the brain cells are getting affected, so they are not, they are in an altered mental state. Okay, the blood vessels are also dilated if you see on the stomach, because the skin is stretching. Okay, you will see the dilated blood vessels. Palms are red. The entire body has the yellow tint of jaundice. Okay, so these are the signs and symptoms of cirrhosis of liver. Viral infections can also lead to cirrhosis, alcoholism, malnutrition, especially vitamin A deficiency, beta carotene deficiency, vitamin E, vitamin C deficiency, and too much of toxins in food, not having enough copper in food, too much of toxins in food, having too much of spicy food. So here in dietary management, again, fiber and fat restricted diet is given. because there is a danger of the esophagus being ruptured. Okay, esophagus can undergo rupture if there is too much of fiber in the diet. Okay, and because of portal vein hypertension, when too much of fiber is there, the intestine has to work harder and faster. Blood circulation has to move very fast, and that could lead to hypertension in the portal vein. Okay, so fiber and fat restricted diet is given. High carbohydrate diet and high protein diet, calorie diet is given, but so fat content will be less. Vitamin supplements are also given. 2000 kilocalorie you have to maintain on a daily basis. Sodium and fluid restriction, because you already have a lot of fluid retention in cirrhosis of liver, because you have seen ascites, how the abdomen has completely bulged out because it is filled up with fluid. Okay, so you don't want more fluid to be retained in the body and lead to swellings. Okay, so you have to make sure that you're giving sodium restricted diet, so that as much as possible kidneys can take away or reduce the fluid in ascites. B complex, vitamin B complex supplementation, vitamin C, vitamin A, whatever malnourishment the patient is undergoing, that you have to correct using supplementation. Ferrous sulfate, folic acid tablets, iron tablets, folic acid tablets are also given. Protein 1.2 gram per kg body weight, because you have to maintain a high protein diet. About just 20 gram of fat is given. And carbohydrates should be given as liberally as possible, so that the liver can store more glycogen and the body will not go into a state of catabolism, that is breaking down itself to survive. And when it comes to vitamins and minerals, or vitamin B complexes, vitamin A, vitamin D, vitamin C for healing, sodium intake is restricted. Potassium intake can be increased. Potassium salt can be administered as well to reduce the edema, to reduce the distension of stomach. Iron supplement has to be given because the patient is suffering from jaundice. Jaundice means what? A lot of red blood cells are getting destroyed. Okay. And only when the red blood cells get destroyed, they will give out bilirubin. Okay, heme will be used up and the bilirubin will be given out. So in jaundice, you will lose a lot of your red blood cells. Okay, so you are in a state of anemia. To correct that, you will require iron tablets and folic acid tablets and vitamin C tablets. So is it clear to all regarding the dietary management of liver cirrhosis? Principles of dietary management. Next, you have hepatic encephalopathies. Here, the brain is getting affected, encephalopathy. Okay. If the patient is suffering from more than one disease condition, we prioritize which is more critical, which condition is more critical, which condition we have to solve first so that the patient can survive, and which condition we can take care of later on. Okay. For example, when it comes to liver cirrhosis, your focus will be on making sure the liver functions properly. If the patient is diabetic, diabetes will not be the first priority. Okay, you can control diabetes with giving complex carbohydrates, but you can't reduce the carbohydrates. You will give insulin. Okay, you will give high carb diet, but you will also give insulin. Okay, but you will not think that the patient is diabetic, so we should not give high carb diet. It will not be the case. The priority will be to deal with liver cirrhosis because it is a fatal condition. Diabetes is a lifestyle disorder. It is chronic. It will give you more um, nephropathy, retinopathy, okay, neuropathy later stages in the life, but it is diabetes is not a fatal condition. Okay, people can live a healthy life with diabetes. People cannot live a healthy life with cirrhosis because their life is at stake. Okay, is it clear which condition you have to give? FS and FA is ferrous sulfate and folic acid. FS is ferrous sulfate, iron tablets. FA is folic acid. So vitamin B complex tablet. So hepatic encephalopathy. So here, because of the damage that has happened to the liver, okay, severe damage that has happened to the liver, it will cause some neurological disturbances in the brain as well of the patient. Okay, especially liver is supposed to break down the nitrogen. It is supposed to remove the nitrogen from protein, okay, and produce other forms of amino acids. But when this nitrogen that is broken down, okay, like ammonia and urea, that is supposed to be broken down, detoxified, and be taken out of the system. Since now the liver is damaged, liver is not able to do this function. So ammonia and nitrogen containing substances are circulating freely in the body, but when they enter the the brain, okay, through blood circulation, when they enter the brain, they will cause some damage. Okay, so that's how it leads to encephalopathy. Encephalopathy means something wrong with your brain, okay, so your neurological system. Because ammonia was supposed to be metabolized by the liver, it was not done. It is still in the circulation, and now it has reached your brain cells. So, what are the other causes that could lead to encephalopathy? If you have intestinal bleeding, it's a hepatitis that you're suffering from a severe infection, some surgical procedures that were done, or too much of dietary protein was given. Okay. If, as I mentioned earlier, if it is a severe case of liver cirrhosis, we will reduce the protein intake and fat intake. Okay. But we will keep the carbohydrates high. Okay. If it is a mild to moderate case of liver cirrhosis, you can still go continue with a high protein diet. But if it is a severe case, to prevent hepatic encephalopathy, you have to cut down the protein because protein is the only macronutrient that has the nitrogen ion in its structure. Okay, and that forms ammonia in your body, and you are not supposed to add more nitrogen in your body, so restrict the protein intake. So symptoms of hepatic encephalopathy, there will be confusion because uh, the patient will go into a stage of uh, altered mental state. Okay, so it happens in stages. In stage one, patient will suffer from mild confusion. They do not know where they are. Okay, they may not identify their relatives. Okay, place, time, they may not identify themselves. Okay, so mild confusion, agitation, irritability, not able to sleep properly. They can't pay attention in one thing. In stage two, they will become extremely tired, disoriented, not able to show appropriate behavior, drowsiness. Okay. In stage three, they are somnolent but arousable. They are, it is a sleep disorder. Somnolent is a sleep disorder in which They are sleeping for long period of time. Okay, but when you call them by name, okay, when you touch them or when you shake them, you call them, you address them, okay, they respond to you. Okay, it's not that they go into a stage of coma, not yet. Okay, but they sleep for a very long time, and when you call them, you call up their name, they can open their eyes, they can respond to you. That is arousable. Okay, that is somnolence. They have a slurred speech, not able to form appropriate words or sentences or phrases. They are still confused and they sometimes may become aggressive. Okay. And in final stage of hepatic encephalopathy, a person may go into a stage of coma. Okay. Yeah, in early stages, cure will start. You will reduce the uh, um, protein intake. Okay. Neurologist, endocrinologist, both will be working on the case. You will require more than one specialist for such patients. Immediate treatment has to be given, otherwise death can also take place at stage 4. If the patient goes into a state of coma, death can take place. Am I audible to all? Am I audible to all? Is my screen visible? So treatment, various measures are used. Different stages will have different modality of treatment. So the main motto here is to remove ammonia from your system, remove the production of ammonia in your body or absorption. How can you do that? First, you have to restrict protein. Protein has nitrogen that forms ammonia in your body. Okay, so restrict protein. Branched chain amino acids. Okay, BCAA means it stands for branched chain amino acids, which are easier to digest, which has more health benefits. And the nitrogen here will not be easily removed. Okay, BCAA is branched chain amino acid supplementation will be given, and medical management will be done by the doctors depending on the signs and symptoms and criticality of the patient. Okay, and what other medications you can give to counteract whatever ammonia has already entered your brain as and started its effect. Am I audible? Is my screen visible? So ammonia has entered the system. Okay, now what can you do to prevent or to counteract the ammonia that has already entered the brain? Okay, or already entered your nerves. So lactulose is a medication and antibiotics as well. Certain if it is because of viral hepatitis, sorry, not viral hepatitis. If it is any bacterial infection that has taken place, at the same time, then you will have to give antibiotics. Otherwise, lactulose is a medication that can counteract ammonia's effect. Some devices that can compensate for liver dysfunction, like the patient can be put on dialysis also. Liver transplantation, if it is a critical care case, liver transplantation will be required. So is it clear to all regarding hepatic encephalopathy? And you will try to give vegetarian protein to the patient, not non-vegetarian protein. Vegetable protein or plant protein is given to the patients who are suffering from hepatic encephalopathy. Next is liver transplantation. So two types of transplantation happens anywhere, not just for liver, for any organ. Living donor donation or cadaveric donation. Living donor is a person who is alive. They give a part of their liver. Okay, and cadaveric donation is a person who has passed away. Okay, they are dead. They could be brain dead as well, or they could, it could be a cardiac death as well. Okay, so when we are taking organ from a dead body, it is a cadaveric donation. Okay, living donation is a person who is still alive. They have just given a part of their liver to you. Okay, so that is living donation. So transplantation, you have a lot of legislation around that. Transplantation of Human Organs and Tissues Act, that's the TOA Act in India, that controls whatever transplantation takes place in India. Okay, there are registration centers for that. Not all hospitals are allowed, or they have the license or the registration to conduct transplantation. So before transplantation and after transplantation, the diet is slightly different. Okay, so pre-transplantation, whatever, if the patient has some malnutrition, deficiency, symptoms like edema, electrolyte imbalance, these things have to be corrected medically. You can provide vitamin supplements, IV fluid. Okay, to reduce edema, the patient could be put on diuretics. Okay, sodium restriction can be done. So all these strategies will be used to correct the malnutrition, edema, or electrolyte imbalance before they go into the surgery. Okay, they have to get normal blood glucose level, normal nitrogen balance as well. Okay, no more ammonia damage to the brains should continue to happen. Protein intake will be around 1 to 1.5 gram per kg, slightly high intake. Energy requirements 35 to 45 kilocalories per kg, whatever is the weight of the patient. So these are the pre-transplant nutrition requirement. BP also has to be, the vital signs also have to be normal before transplantation or on the day of surgery. So food that you can give to the patient here is low protein food like clean cut meat or poultry. It's better to avoid animal meat here. Well, try to give more vegetable based protein diet, because all animal meat or all animal based protein comes with a factor of fat. Okay, animal sources of protein naturally are high in fat. Vegetable sources of protein, okay, they are not that high in fat. Okay, so the patient has to be on a fat restricted diet as well. So that's the reason why we do not prefer a lot of animal protein. Okay, and even if you are keen on giving animal protein, if it is chicken, chicken breast, boneless chicken, or chicken breast, Chicken thighs would be better. Egg, give egg white, avoid egg yellows. Okay. So you have to cherry pick your protein sources in such a way that they are high in protein but they are low in fat. Soya beans, soya chunks, soya beans are a great examples here. Legumes, sprouted legumes are also a great sources here. Okay, so fat should be less. The fat content in the food you choose should be less, naturally less, low in fat, but high in protein. Okay. Soya protein can be given, any form of soya protein, tofu, chunks, brown rice, nuts, seeds, avocado, oats, lentil, chickpeas. Complex carbohydrates are preferred than simple. Try to avoid any spiced or sauteed, fried, deep fried food. Bakery items, okay. Processed food should be avoided in the pre-transplantation diet. Post-transplantation nutrition, after the transplantation has been done, your diet should be low on, again, low in cholesterol and saturated fat, high in vitamin C, okay, high in vitamins and minerals. The patient should be well hydrated to recover from the surgical wounds. Adequate calcium, vitamin D intake should be given along with transplant medication, because the patient will be in an the patient will be given immunosuppressive drugs. Okay, because now they have received a part of a liver from a completely new person. Their body can reject that. Okay, so the patient will be put on immunosuppressing drugs so that their own body will not reject the organ, transplanted organ. Okay, so diet should be based in such a way that it does not triggers the immunity. So anti-inflammatory diet has to be given here. You have to focus on foods that are naturally anti-inflammatory in nature. Next is cholecystitis or cholelithiasis, gallbladder disorders. Okay, cholecystitis means inflammation of the gallbladder. Cholelithiasis means gallbladder stone. Lithias means stone. Okay, chole relates to gallbladder. So, cholelithiasis, it's the gallstones. It's very rare in rural parts of India, but in urban India, it is very common because with obesity, your obesity lifestyle, sedentary lifestyle, that can lead to gallbladder disorders. Any history of liver disorders can also trigger gallbladder disorder, because if the liver is not is producing a lot of bile juice, or it is producing a concentrated form of bile juice, it will sit in the gallbladder, because whatever the liver produces, okay, whatever bile juice the liver produces, it secretes it into this duct. That duct goes into the gallbladder. Okay, so for some time being, the bile juice will stay in the gallbladder. As soon as you eat something, as soon as the food enters the stomach, the gallbladder gets its through the receptors, gallbladder will get the notification that it has to empty the bile juice into the stomach. Okay, so for a while the bile juice stays for few hours. The bile juice stays in the gallbladder. For example, right now you're listening to the class. If you're not eating anything, okay, you're paying attention here, you're not eating anything, your gallbladder right now is filled with bile juice. Okay, after the class, if you just go have a cup of tea or snacks, as soon as your stomach understands that your brain understands that something is going to enter your stomach, immediately your gallbladder will get empty. It will empty the bile juice into the stomach. Okay, so imagine a situation if the bile salts are very concentrated in form because of the damage that caused in liver. Okay, bile juice is very concentrated, and it is sitting here for many hours, because when you are having liver damage, you will not have the feeling to eat food. You will have anorexia. Okay, so one time a day you may have food. So for 16 to 18 hours, your gallbladder is filled with concentrated bile juice, and it will form the concentrated bile juice will turn into, it will solidify within the gallbladder, and it will cause gallstones. Okay, is it clear how stones are formed? Cholelithiasis happens. Is it clear to all? And because of this gallbladder stones, the gallbladder is not able to push the juice completely out of it, and the gallbladder will undergo inflammation. Is it clear to all how it happens, how the entire process happens? So what are the conditions that lead to cholelithiasis? First of all, obesity, as I mentioned earlier. You are having a high fat diet, okay, and suffering from constipation, not having enough amount of fiber in food. Women who have given birth many times, more than 3 times, 2 times, okay, that is multiparity. Even in intermittent fasting as well, in intermittent fasting as well, you are not fasting straight for 16 hours at a stretch. Okay, you are in a routine where your liver is healthy. Okay, your liver is not damaged. People who suffer from liver damage, intermittent fasting will not be given to them. Okay, people who suffer from liver damage, they are not supposed to follow intermittent fasting. People who are diabetic, they are not supposed to follow intermittent fasting. Okay, only people, those who are healthy, you have a healthy liver, you do not have any chronic diseases. Okay, in that case, intermittent fasting is recommended. Stones will cause pain, not as same or not to an intense pain like kidneys, but it will cause abdominal distension, indigestion. You will always be you will always feel nauseated, feel like vomiting, because your body is not digesting fat as it is supposed to be, because your gallbladder is not releasing enough amount of bile juice. Okay, so you will suffer from a lot of digestive problems. Fasting cannot be recommended for diabetics because their blood sugar level will fall way low, way low. They will become hypoglycemic, and it is fatal. Women who have given lot many births, okay, multiparity, more than 2 children, more than 3 children, and not having enough spacing between kids, liver cirrhosis, and resection disease of the terminal ileum, that is the end part of your intestine. Okay, if that undergoes resection, that would lead to gallbladder stones. Abdominal surgeries, if the patient is put on uh, TPN for a long time. So TPN means total parental nutrition. The patient is not taking anything via mouth. Okay, patient is not taking anything from mouth, so nothing is going in the stomach. So the gallbladder will not empty the bile juice. It will be full of bile juice for pretty long time, because nothing is entering the stomach through mouth. No oral feeding is given. The patient is put on TPN, total parental nutrition, that is through the IV fluids and all. The patient is kept alive. So those patients can also develop gallbladder stones. Estrogen and progesterone um, supplements, like being on oral contraceptive pills, diabetes, obesity. Okay, these all are the high risk factors. Multiparity, it could be because of the chronic obstruction, because when the child is growing, the way how the intestinal organs shift from its normal position, the gallbladder also shifts. Okay, so frequently if the gallbladder is shifting because of pregnancy, that could lead to obstruction in the flow of bile juice. So for cholelithiasis, you can also do the colectomy, that is gallbladder removal can be done. Stone removal surgeries can be done. Okay, depending on the criticality of the condition. So symptoms, you will have a colicky pain, upper right quadrant of your stomach. You will have a colicky pain, very similar to kidney pain. Doing a blood test, you can identify if it is a gallbladder stone. You can also do a scanning. Then ERCP is a treatment. It's a shock wave treatment given. And also you can insert fiber optic device into the duodenum and then remove the stones. You can destroy the stones, you can remove the stones. Cholecystectomy, that is removal of gallbladder, removing the gallbladder completely and doing the bypass of the ducts directly to the duodenum. That can be done. Obesity, high calorie diet, sudden weight loss, okay, because of um, crash diets and all, certain medications, liver diseases, okay, these can also lead to gallstones. And there are different types of gallstones as well: cholesterol stones, pigment stones, mixed stones. Okay, cholesterol stones is made up of cholesterol, only fat that has hardened. Okay, pigment stones, it's bilirubin stone, only bilirubin salt, bile salt. Mixed is both cholesterol and bilirubin will be present, bile salts will be present. It can have calcium salts as well. So next is pancreatitis, inflammation of the pancreas. You have two types of pancreatitis: acute pancreatitis and chronic pancreatitis. So it is again associated with alcoholism. Okay, people who have issues with alcoholism, they largely suffer from pancreatitis as well. People who are diabetic, they also suffer from pancreatitis in the long run. Endoscopy, ERCP is endoscopy. Okay, you are inserting a fiber optic device through your mouth and you're visualizing what kind of stone, what is the amount of stone. It can be it's endoscopically you can remove the stones as well. So in pancreatitis, the pancreas will be inflamed. Okay, and inflammation could be of various causes. Okay, it could be infectious as well. Some bacteria can also cause pancreatitis, viral, bacterial. Some toxins can cause it. If you have any obstruction in the pathways of the pancreatic juices, or any gallstones that are causing any obstruction in the pancreas, because the gall ducts that are supposed to release into the duodenum, you can see here, this is the opening. Okay, and the bladder's duct is passing through the pancreas, inside of the pancreas, and then it is opening near the duodenum. So if there is any obstruction here, okay, any obstruction because of stones causing any obstruction in this part that is inside the pancreas, okay, that could also cause pancreatitis. It can cause inflammation in the pancreas. Am I audible to all? Is my voice clear? Am I audible to all? Okay. So in acute pancreatitis, you will have pain, you will have fever, nausea, vomiting. Okay. It's in mild form. Immediately you can do some treatment and you can cure yourself from this thing. You can stop eating food for some time, and you can be on IV fluids in hospital. Okay. Painkiller will be given to reduce the pain. When you touch the area where pancreas is, that is on the right side, okay, right side of the stomach, when you touch, there will be tenderness. When you press it, you press the area, you will feel pain, that is tenderness. And small meals that are carbohydrate, high in carbohydrate, is given to the patient, because carbohydrate will cause less pancreatic stimulation as compared to protein and fat. If you're giving a protein and fat based diet, pancreas have to work harder to digest them. To prevent that situation, carbohydrate based diet is given. Medications will be given, painkillers will be given. The patient will be put on IV fluid therapy for recovery. Main thing is you do not want this to convert, this acute pancreatitis to convert into chronic pancreatitis. Chronic pancreatitis, when acute pancreatitis is not treated, okay, you let go of the symptoms, you oversee the symptoms, or you'd get diagnosed it pretty late, it has turned into chronic pancreatitis. Okay. Causes are, it is hereditary in your family, it is hereditary. You suffer from cystic fibrosis, it's a lung disorder as well. Okay. And uh, it's genetic. There is a specific gene, atypical CF, that is a gene mutation that leads to chronic pancreatitis. Sometimes your own immunity, your immune cells have started attacking the healthy pancreatic cells. So it's an autoimmune pancreatitis. Too much of alcoholism, smoking could lead to that. Acute pancreatitis, when not treated, will become chronic pancreatitis. Again, the patient will be put on a high calorie diet, 35 kilocalories per kg, high protein diet, okay, but fat restriction, moderate amount of fat is given. And if it is a diabetic patient, carbohydrate monitoring is done along with insulin therapy will be given. Along with that, carbohydrate monitoring will be done. It can be reversible, but you will definitely have a risk of developing pancreatic cancer. Okay, you will have a risk of developing pancreatic cancer in the future. Okay. MCT oil should be used, medium chain triglyceride fat should be used. Avoid saturated fat, trans fat based food. Low fiber food is given, because chances are that high fiber diet can absorb all the pancreatic juice, whatever pancreatic juice a diseased pancreas is producing. Okay, already the organ is suffering. On top of that, whatever little pancreatic juice it is producing to help in digestion, okay, fiber can absorb that as well. So fiber restricted diet has to be given. A lot of vitamin supplements will be required here. Vitamin A, E, D, K, B12. Okay, antioxidants can be given through supplementation. Vitamin D supplementation should be given. Lipase is a enzyme produced by pancreas, but if the pancreas are undergoing chronic pancreatitis, the production of lipase will be low. So lipase supplements can be given. Okay, especially if the food has fat content, lipase supplements has to be given to digest the fats, because lipase is supposed to be produced by pancreas, But if the pancreas are damaged, it will not produce enough amount of lipase. And to keep the pancreas healthy for the general public, avoid high cholesterol, high calcium diet, avoid excess consumption of alcohol, smoking, okay? Behavioral changes, lifestyle changes has to be done. Lipase supplements is enzyme. Lipase is an enzyme that breaks fats, that breaks down fats. No, just by exercise and hydration, pancreatitis will not be cured. You will require a medical management. So this is a pancreatic diet chart. Fat is controlled here. You can see just 10 gram of fat. It is completely fat controlled. High calorie, high protein diet is given. High carbohydrate diet is given. Fat should be controlled. Low fiber should be given. Medium chain triglyceride oils can be used. Vitamin supplements has to be used. Calcium supplements has to be used. Low fat food or low fat formulas. If the patient is on NG tube feeding, low fat formula has to be used. And if jejunal feeding is required, in which you are not allowing the food to come in contact with the stomach, duodenum at all. Okay, you are inserting the NG tube in such a way that it ends at the jejunum. Jejunum is the middle part of your small intestine. You have duodenum, you have stomach, then you have duodenum, then you have jejunum. So in this type of feeding, you are avoiding the food to come in contact with either the stomach or the duodenum. Okay, directly the NG tube will end at the jejunum. Okay, so whatever feed you give, it will directly reach the jejunum. Pancreatitis can make a person diabetic, okay, because insulin production or even the glucagon production will be affected. The thoughts about diet in liver and pancreatic diseases.